chance of living with the transplant and 0 chance without.
Kate Mitchell was the logical choice as the donor because she was physically small and compatible, and there was no question about what she would do. So they operated on Kate, removing a piece of her liver for her daughter.
Once that's all done, I take that next door and we take Colleen's liver out and we put this new segment in.
Ralph was shocked at how ill his wife Kate looked after surgery.
It was very surprising to me, in fact devastating to me, how sickly Kathleen looked after her surgery. She looked pale, she looked like a corpse to me. And that was probably the hardest thing I saw and went through the whole time because I was completely unprepared for that.
To avoid the risk of contamination, Kate was not allowed near her baby following the operation. But Dr. Colombani took a picture of Colleen, which he brought to Kate in the recovery room.
It was such an emotional moment. Because even in the picture, she, had all these tubes everywhere and she was on a respirator and everything. But just the fact to know that she made it out of the surgery it was wonderful.
As the winter holidays approached, everything was finally on a positive path for Colleen.
And then right after Christmas, took another downturn and she started acting lethargic and again, just not herself.
When Dr. Colombani saw Colleen, he alerted ICU and admitted her within minutes. Tragically, blood tests revealed that Colleen's liver and bone marrow showed signs of leukemia.
When everything goes perfectly, something can intervene out of the blue that will, like a lightning bolt, that will just destroy everything, and it really is very upsetting for everybody.
I just burst out crying at one point, and Dr. Schwartz and I were crying together because it was just, the doctors had been through as much as we had, and then to be hit with this, I think we were all just, just stunned.
Of course, it was a major blow for them and for us as well. We don't like losing. And this looked like pretty formidable odds because the lymphoma was in her bone marrow. And at the time, we could not find any survivors of this kind of tumor.
You can see the abdomen just swelling by the hour as the tumor's growing. So this is one of the few oncologic emergencies, meaning that the cancer has to be treated right now. No stops and no wait.
Dr. Colombani consulted oncologist Dr. Wing Leung. Since they could only find case histories that had ended in death, they were fighting the disease and the clock.
And so I called around, I talked to a few of my friends and asked them what their experience were, and they basically said, well, patients all died. Did you treat them with chemotherapy? Well, no. We tried once. The patient died of infection.
So Dr. Colombani created a new mixture, an untested chemo formula just for Colleen, and he made another radical decision. In order to give her body the best chance of fighting off infections caused by the chemotherapy, he took Colleen off all rejection medication.
The cancer, I wasn't sure she was going to make it through.
For 5 months, Colleen endured chemotherapy. In fact, the first 2 years of her life were a constant battle for survival.
Her second birthday was coming up in a couple of months, and then to just see her laying lifeless, in a hospital bed was really difficult.
But finally, the battle was won. Dr. Colombani had made 2 life-saving decisions on Colleen Mitchell's behalf. First with a living donor transplant, then with a radical cancer treatment. Now 4 years old, Colleen has no sign of cancer. And unlike almost every other transplant patient in the world, Colleen never went back on the immunosuppressant drugs. It seems her body won't reject the gift her mother gave her.
We have the disasters and the heartbreak of our failures that we're not responsible for many times, but still a failure in our minds. But then we have the happy endings.
Just seeing her today, it's hard to imagine how often this brave little girl has battled death and won. We'll be back in a moment. Next on Vital Signs.
All of a sudden, Dr. McKay came in. He said we found the fungus in her skull.
Her doctors had never seen a survivor once the infection reached this stage.
How pardon me, would you have any grape upon honey mustard?
Dear boy, there's no such thing.
Is to.
Is not.
Is to.
Is not.
Grape Poupon honey mustard. For everything from a chicken dish to a turkey sandwich.
Is to.
Is not.
Is to.
I heard about this car that's supposed to be safe for you and your kids, but it's so expensive you probably couldn't afford to have kids and that car at the same time. How about a Chevrolet Cavalier? It comes with a safety cage, dual airbags, even standard anti-lock brakes. So for around $12,000, you really can get everything you want in a safe car, including kids. Who decided that only people who can afford expensive cars should be safe? Get the car that's easy to own, a Cavalier. Genuine Chevrolet, the cars more Americans trust.
There's something big at McDonald's. Right now, a triple cheeseburger is just 99 cents. A big beefy burger in honor of Hercules from Disney's new movie in theaters now.
What you folks need is a hero.
And if you've got a hero-size appetite, McDonald's is just the burger. It's hot. It's tasty. It's a triple cheeseburger for just 99 cents. So hop in your chariot and hurry to your McDonald's, because this big deal won't be around for long. It's a big burger with a small price.
Did you know every day your eyes are being bombarded by harmful UV rays? That's why AccuView contact lenses are introducing UV protection. Now AccuView gives you the comfort of fresh new lenses that block up to 95% of harmful UVB rays. It's the only leading brand that does. Ask your doctor for a free trial pair and see why more eyes trust AccuView.
Why would you wear anything else?
It was a huge idea. He'd be on time, and the pants would get dry. Sometimes he thought, I'm so smart, it's scary. Sir, it's a dirty job, but somebody's got to do it.
It's GMA's Friday in the Park with the very best in barbecue and music from country's Dina Carter. The weekend starts here.
Good Morning America.
ABC tomorrow.
How far will you go to get more? In Port Charles, the new daytime drama from the producers of General Hospital. Weekdays. Get ready for more.
Sometimes patients can teach doctors a thing or two about perseverance, faith, and healing. That's what the case of little Jolisa Jojo Janiha is all about. Patsy and Wayne Janiha and their 3-year-old daughter, Jolisa, were in Holbrook, Arizona at a family celebration.
I braided her hair that morning, not knowing that I would never braid her hair again.
Jolisa was out of her parents' sight when suddenly the sounds of barking dogs and screams caught everyone by surprise. Patsy and Wayne ran to help and were shocked to discover that it was their own daughter who had been viciously attacked by some neighborhood dogs.
I was stunned, and I just had to come to terms this was my baby because she was covered in blood and dirt. And, you know, it was hard to grasp.
I just told Wayne, I said, that's her. Get her. Go.
The hospital was about 3 or 4 blocks away, and so I picked her up and I ran with her to the hospital.
Jolisa had lost her scalp and parts of her ears in the attack. She was bleeding and in shock. Patsy ran to the nearest church and prayed for strength.
I had to take it to God. I had to give it to him. I said, here, this is your child. I'm giving this to you. I want you to handle it for me because I can't take it.
Jojo ended up in St. Joseph's Hospital in Phoenix, where plastic surgeon Dr. Bendy So began caring for her.
Jojo had lost her entire scalp. Also, a significant component of both of her ears were gone, so we have a problem. Because of the total scalp loss, you have to find something that is large enough to cover up the entire skull. So it's very difficult.
Once in surgery, Dr. So cut muscle flaps from Jolisa's upper back and used them to cover her skull. He then attached delicate blood vessels to the new tissue to feed it fresh blood. Dr. Jeffrey Hill took over Jolisa's daily care in the pediatric intensive care unit.
When she first came back from surgery, she was doing very well. And everything was doing what it was supposed to do, and everybody was happy with the outcome of the surgery.
But 3 days later, disaster struck. Jolisa contracted a severe case of pneumonia. And then unexpectedly, 2 days later, her lungs and her kidneys began to fail.
Over the course of a week, she went from being a routine case to being certainly one of our sickest children at that point.
Certainly, death is knocking at her door. There is no question about that.
We couldn't move her, we couldn't hold her. All we could do is tell her that we were there to be with her, to pray for her.
Even with her life slipping away, the delicate grafting surgeries on Jolisa's scalp had to be continued. Too sick to move her to the operating room, a makeshift OR was set up in the ICU. It was during one of these surgeries that Dr. So made a puzzling discovery.
We noticed that she developed a small purple blister on her left ear, or where her left ear was.
Lab results confirmed the doctor's worst fears. JoJo was being attacked by a deadly fungus called mucormycosis, which may have been introduced at the time of the dog bites. There is no known cure for this infection.
Worst scenario was the case. The infectious process is very extensive. That goes into the center of her head, into the upper part of her left side of her neck. It's kind of like a tip of an iceberg that we're looking at.
I asked him, how long do we have with her? And then they said she might go tonight, tomorrow. It's just a matter of time.
But as they would many times, JoJo's parents simply refused to accept the grim prognosis and sought the help of neurosurgeon Harold Recate, a family acquaintance.
At that point, there had been no survivors of mucormycosis in that area of the skull. It not only eats up the bone, but it eats up the blood vessels and nerves, and it just sort of crawls along the blood vessels and eventually gets into the brain where they die. It's just as evil as it sounds. And the only chance was to take this extraordinarily radical approach of debridement, which means removing every piece of the dead tissue.
And he told us that it's going to take a miracle for her to survive this. It's going to take a miracle.
JoJo's story continues in a moment.
You did your job, you did it well. You gave your all and it was swell. And now it's fun time, fun in sun time, on making whoopee.
The brand new DeVille for the time of your life.
I could use something for this headache, Liz.
I've got Tylenol.
I thought you used something else.
No, my doctor told me to switch.
Really? How come?
He said Tylenol won't irritate my stomach the way aspirin and even ibuprofen sometimes can.
And Tylenol's strong enough.
Oh yeah, it works great.
To avoid the risk of stomach irritation, Tylenol is the pain reliever doctors recommend most.
You ready for more guy talk?
I am now.
Tylenol, the pain reliever hospitals use most.
Things are changing every day. Come in and see what's new. Tons of brands for everyone, and a big surprise for you. This is the first place. We always try, trust us like us. You've got so many sides. Come see the many sides of Sears.
This is ridiculous.
You know, I'm just trying to do a good job here. I don't know where they come up with these ideas. It's supposed to be easy. You're supposed to bring two people together, and that's that. But in this case, it's like oil and water. Where do they think this stuff up?
Dharma and Greg, an unlikely romance, premieres this fall on ABC.
Vital Signs will continue in a moment here on ABC.
Sunday, Oscar winner Angelica Houston, Sam Neill, Kira Sedgwick. From My Best Friend's Wedding, Dermot Mulroney.
We're all a little crazy, aren't we?
From the best-selling novel Family Pictures, ABC Sunday.
Leave the world behind with a confident, capable Isuzu Trooper for $299 a month for 36 months and $1,144 due at lease signing. It's the Isuzu Great Escape event, which is now even greater with exceptional offers on every Isuzu vehicle we sell.
At Room Plus, you can choose from 1,000 bed combos and about 30 colors.
Cut! Oh, it's that kid again.
You mean Dennis? He's why everything you buy at Room Plus is Dennis the Menace proof.
Look at that neat stuff just around the corner, Ralph.
Room Plus celebrates your kids' independence with furniture that's made for them at super sale prices for you.
Come on, Ralph. Let's check out the loft bed.
Don't forget, save big at our July 4th sale. And be safe.
Room Plus, just around the corner.
They're back, together again, fighting the forces of evil. And only one thing can help them, defeat the powers of darkness.
Hi, welcome to Amico.
I'm here for my free Maglite, and I'm in a bit of a hurry.
The free Maglite at Amico. Inspired by the new Batman and Robin movie, it's yours with 4 fill-ups of Ultimate or Silver. So drop into Amico now, before this offer vanishes into the night.
Batman will find this most useful.
Oh, yeah, right. Batman.
Man Without Pants sues Air France. The story tonight.
Three-year-old Jojo Janiha survived a vicious dog attack, but now a deadly fungus was infecting her brain. Refusing to give up, her parents asked Jojo's doctors to take the most radical action possible to remove every piece of dead tissue before the fungus killed her. Dr. Jeffrey Hill.
I always try to think, as a parent, what would I do? What would I want done? And with my experience, if that had been my child, I'm not sure I would have made the decision to go ahead with the surgery.
Despite the overwhelming odds against Jaleesa's survival, the Janihas insisted on going ahead with the surgery.
And I went to her bedside, and that's when it hit me, and I was overwhelmed. And just the fear of losing her, I told her, Jojo, this is not it. Please don't go. And I was in tears, and as sick as she was, she had managed to pick her blanket up and to wipe my tears and to put her arm around me and say, Daddy, it's okay. It's all right. That's the way she said it. It's all right.
The night before the operation, Patsy was allowed to hold her daughter for what could be the very last time.
I want to hold on to her all night. That was my most important thing, is I wanted to hold her. There's so many prayers that went out all the way from California to New York, North Carolina. I had one lady saying that she had visions of her going through a crowd, and these people were applauding her.
As the family waited and prayed, Jojo went off to surgery. Dr. Recate and the other surgeons quickly discovered that Jojo's condition was even worse than they had anticipated.
I mean, we looked at it and we were horrified by how much we had to remove.
Due to the extensive damage, Dr. Recate was forced to take out Jaleesa's carotid artery, jugular vein, and some of the nerves connected to her voice box and face.
I kept thinking, well, what are we going to do at the end of all of this? How are we going to try to put this together again? And I figured we can't worry about that now. We'll have to worry about that later.
Jaleesa survived the radical surgery, but Dr. Recate informed the Janihas that at the very least, JoJo would probably be paralyzed on her left side.
There was a lot of skepticism, I think, among those of us who'd seen how sick she was, that she could still be a real person.
But just 4 hours later, when the family pastor, Pam Phillips, asked JoJo to move her legs, JoJo did.
Then we told her, "Can you kick?" And she gave us a really good kick with the leg that wasn't supposed to move. Patsy and I were so excited that we wanted to grab each other and start jumping up and down like little girls, but we restrained until everybody got out of the room. When everybody got out of the room, then we did it.
JoJo was exceeding everyone's expectations, but 2 weeks later, the deadly fungus was back.
They found dead bone at a significant distance away from the site that we had debrided, and it was very close to the only blood vessel she had left to supply blood to the brain. If the fungus had actually gotten into that blood vessel, then she would die on the table.
All of a sudden, Dr. McKay came in, and I knew something was wrong.
We could either stop now, in which case she would die in a few weeks, or we could go ahead and she might die that minute.
We all get emotionally involved when things like that happen. You know, especially somebody like her. She's only 3 years old. You know, full of life.
With the family's blessing, Dr. Recate went back to work on Jaleesa's brain.
And we were able to scrape the infection off of the surface of the blood vessel without getting into it. And that was either fate or God or luck or whatever. But if it had gone further than that, a millimeter further than that, it would have been over.
But 45 minutes later, JoJo was back in intensive care, alive.
It was something, we were so happy. We were just jumping for joy.
It was very clear that Jolisa was a tough little kid. We didn't know what was driving her, but we were sure at that point that if anybody could make it, it would be Jolisa.
JoJo was in the hospital for 3 more months.
I don't know exactly what time did I have this particular dream about JoJo, but I have a dream of her showing that she's checking out of the hospital, she's going home with a smile on her face.
And that dream came true. It had been 119 days since JoJo's initial attack, and now to the amazement and delight of her family and her new friends at St. Joseph's Hospital, Jolisa Janija was going home.
The strength between the parents and the child, the feeling that things were going to turn out positively, created energy for everyone taking care of them. They didn't allow any of us to become discouraged. They weren't going to have it. And I think that rather than picking up this family, they were picking all of us up all the time.
I think if there's one thing that I personally learned from this whole process is that you can never give up. No matter how grim it is. You never really know unless you try.
Today, JoJo is a happy 4-year-old who enjoys fishing with her father and riding her bicycle. She continues to go through surgeries to care for the grafts on her scalp, along with physical and speech therapy to rehabilitate the paralysis on her left side. Although she will never have hair, doctors are hopeful that she will go on to lead a healthy and normal life.
Sunday after she got out of the hospital, I remember us going to church. And everybody turned around. And everybody stood up. They were applauding her. And I remember telling Wayne, this is the vision they had of her. That was the happiest days of my life.
We'll be back in a moment. Next, on Vital Signs, a young girl comes down with a deadly plague, straight from the Middle Ages.
Something has survived.
It's the lost role from Kodak. Just buy any Kodak product with the Lost World Jurassic Park symbol. Look for the game piece inside. You could win a Fleetwood RV, a trip to New Zealand, even one of these prizes. And everyone gets savings from Kodak. The Lost Roll is out there. Find it before someone else does.
I don't just paste my dentures anymore. Now I bond them with C-Bond denture adhesive.
Only C-Bond is a soft, micro-thin seal with 2 powerful adhesives that bond dentures to your gums, so they can hold and fit comfortably all day.
I can bite and chew with confidence.
And C-Bond is easier to use than pastes or powders with no messy cleanups.
I'll never paste my dentures again. I bond them.
Bond your dentures with C-Bond.
Drop everything. Let it go. Get moving to Kmart Summer Fun Sale. It's all here and it's all on sale. Selected ladies' swimsuits are just $9.49. Family swimwear is an incredible 40% off. Big thirsty beach towels are a low $3.99. This 34-quart Coleman cooler is only $9.99. And a backyard rectangular pool is Kmart priced at $39.99. Don't miss the summer fun sale at Kmart. Absolutely all you need for summer play. That's the Kmart way.
I work for a dermatologist, but I'm also a mom. So when parents ask about insect bites, I tell them only Cord-Aid Fast Stick has a roll-on to stop the itch and also help heal the bite. Benadryl doesn't. Convenient Cord-Aid Fast Stick. Fast relief for insect bites.
New bottle, new formula, new finesse with hydrating silk proteins. Smooths every strand. For hair so soft and silky, it has to be touched. New Silk Protein Finesse.
It's witchcraft.
Get the look that gets the touch.
If you haven't talked to your kids about drugs, make an appointment.
Yo, Mom, what's up?
Next, there are killers among us.
Eventually, they'll get to you.
It could be your neighbor or pastor or doctor, and you've got a 1 in 3 chance of running into one.
How much are we going to take?
What can you do to protect yourself and your family? A turning point that will hit you like a truck. Driving drunk. Next.
The plague. It's not a word you hear very much in the 1990s, but a young family in Utah found themselves facing a medieval disease in modern times.
We both felt like we belonged out here.
We have 10 kids, so this was our idea of our dream, to come out here and have our cows and our horses and chickens and kids.
For Cindy and Tim Rolfe, their dream became a reality in the summer of 1994 when they moved from a suburb of Salt Lake City to Park Valley, Utah, 180 miles north.
The place needed a lot of repair and stuff, so me and Eva came out here in advance with some of the kids, and Tim was still in Salt Lake, and we were tearing up carpets, cleaning, painting, just scrubbing everything, you know, just getting ready for everybody.
The local wildlife had taken over long ago. From day one, the family cleaned up animal droppings. Unlike the family, Indigo, the house cat, didn't seem to like their new home environment.
Shortly after we arrived with the cat disappeared. There was stray dogs here and just an atmosphere I guess she didn't like.
Right before Eva left for summer camp, Indigo finally came home. Eva went off to camp, but before long she began to get sick. Very sick.
I asked Eva, I says, what's wrong? You know, she says, I've got a headache. So I just figured flu, you know. We were both feeling really bad. We just got sicker and sicker.
Eva was rushed from her grandmother's house to a local hospital and finally to Primary Children's Medical Center in Salt Lake City. Dr. Mark Rowan was on call.
She was gasping for breath, and the only words that she could utter were, I can't breathe, over and over again. When you see a child in this much respiratory distress, your first emotional response is sheer terror. This child is going to die right before my eyes unless I do something. So, and then the emotional response has to take second place to the professional response. So it became very evident that Eva needed something more than just supplemental oxygen, that we needed to intubate her to help provide her ventilator support. When we went to intubate Eva, we were looking down her glottis, the opening into her trachea. You could see a lot of purulent material bubbling up, grossly infected material. So before we actually put the tube down, we took a little culturette vial and obtained some of this purulent debris and sent that off to the microbiology lab.
Dr. Rowan put Eva in an isolated room, but what had made Eva so sick so quickly?
Mom had given me several interesting clues. First clue was that she was busy cleaning up a lot of rodent nests in her cabin. Well, that piece of information made me suspicious for hantavirus. Hantavirus is thought to be present in mouse and rat pellets. And so you aerosolize these mouse droppings, you inhale them in, and they can give you a very rapidly progressing pulmonary disease, which Eva demonstrated.
Dr. Rowan's boss, Dr. John Christensen, is director of the hospital's epidemiology program.
By the time I arrived in the critical care unit and started looking at her x-rays and looking at her laboratory tests, it was quite apparent that hantavirus was not the most likely diagnosis on her.
But then Mom also brings in the story of the cat who had been out, lost in the wilderness for several days, and then comes back in and has these very large abscesses that she and Eva subsequently drain. And these abscesses would make you think of other diseases like brucellosis, like anthrax, like tularemia, or like plague. One of the things I started to wonder was, could these be buboes? Buboes are the classic physical finding that you see with bubonic plague.
The plague, Black Death, is estimated to have killed a third of the population of Europe in the Middle Ages. Is that what this child of the 20th century could have?
You cannot wait for the culture results to come back, because obviously in 3 days, the patient most likely is going to be dead. In the critical care unit, we decided that we definitely wanted to cover her with an antibiotic that would be active against the different organisms that could be causing her infection, and specifically plague.
Eva did not have any of the manifestations of bubonic plague. She did not have any buboes in her neck. She just had a very rapidly progressing pneumonia. But there is a variant of plague called pneumonic plague, caused by the same bacteria, but it is rapidly progressing and oftentimes fatal.
Within 48 hours of Eva's admission, doctors Rowan and Christensen had their answer. 15-year-old Eva Rolfe had the highly contagious pneumonic plague.
What you get from the medical literature, especially in people who have lung involvement with plague, is that the mortality is close to 100%. The major concern we had as physicians was the fact that not only the exposure to her immediate family, but also she had been in a girls' camp. And the word that we got is that she probably had been relating to close to about 200 adolescents of her same age.
Dr. Christensen immediately called Utah State epidemiologist Craig Nichols. Time was precious. People had to be alerted to watch out for the plague's symptoms.
In a matter of 4 hours, we located most of the campers or representatives and had them at a meeting where we could talk about plague and start talking to people who had been exposed and see if we had any symptomatic individuals.
The campers' families were told it was critical they see their doctors if they had flu-like symptoms and to begin antibiotics immediately. Meanwhile, 15-year-old Eva was barely clinging to life.
She was in a glass room. It seemed like hundreds of tubes coming out of her body. She wasn't conscious, and a big breathing tube going in her mouth, just all kinds of medicine going in.
Her kidneys started shutting down. Everything was just getting worse. And it was at that time I almost gave up hope, like, oh, well, if she's not gonna make it, then I asked the Lord, just don't make her suffer.
It's a race against time for the body to respond to the infection, or for the infection to grow to such numerous amounts of bacteria that the body cannot logistically conquer it.
So while Eva's body was battling the plague, Dr. Nichols' team, including members from the Centers for Disease Control, set out to try to find the source of the bacteria. It is usually carried by fleas.
We know that plague is in our wild rodent population all across the state. Cats become infected usually by feeding on infected rodents. They'll get the bacteria into their mouth, and then they'll get an infection in the neck.
An infection just like Indigo had when she came back to the ranch. Epidemiologists went out to trap rodents, all in the search for the source of the bacteria.
But we had a hard time finding somebody brave enough to go to the ranch and pick up the cat. But a tough old rancher, a neighbor, said, "I'll pick up the cat." Drove his pickup over, put on his leather gloves, got the cat, put it in a cardboard box.
Unfortunately, Indigo died en route to the veterinarian hospital, but the lab results did confirm the animal had the plague. Luckily, thanks to the quick action of the doctors and epidemiologist, no one got as sick as Eva. But how did the plague enter her lungs?
It could have been on the cat's breath. My own theory is that as she was cleaning the animal, cleaning out these abscess material, she might have infected herself. However, it's certainly possible that with the animal sleeping on her chest and having a pneumonia, it could have potentially had the plague bacteria on its breath.
Eva spent 6 weeks in intensive care, and defying the odds, she survived.
The recovery was so amazing. I mean, she was gone for so long, you know, just out of it. I was like, where were you, Eva?
I think in my own way, I've learned to appreciate life more.
Although it was a cat which caused Eva's frightening bout with the plague, she still loves them.
I really see cats the same, you know. They're very much a necessity out here. If we did not have cats, there would be rodents all over the place. And I love them because cats can become so close to humans, and I love them.
It's good to see you again. It is ironic now that we're on the cusp of the 20th century, that a disease process that's 500 years old suddenly rears up again here in Utah, and yet is just as deadly as it was back then and almost cost this girl her life.
We'll be right back with more Vital Signs after this.